in.
That today's conference is being recorded. I would now like to hand the conference over to your speaker today, Mr. Mike Schumer. Thank you. Please go ahead, sir.
Thank you for joining us for the COVID-19 media call for June 24th. We'll start today's call with the situation report from Infectious Disease Director Chris Ersman. After that, we'll be opening it up for questions from reporters on the line. So with that, I'll turn it over to Chris.
Thank you, Mike. Globally, the total of the cases globally as of this morning was over 9.2 million cases and 477,000 deaths. And in the United States, we were at more than 2.3 million cases and 121,000 deaths. In Minnesota today, we have a new total of 33,763 cases, up 304 from yesterday. The median age of our cases is 39.8 years old. A new total of deaths in Minnesota is 1,397, up 5 from yesterday. Some of you noted that we're reporting 5 new deaths from today, but the total did not go up by 5, and that was because a death reported back in May was determined not to be a death from COVID. So the death total is correct, and it was 5 new deaths, but because we subtracted 1, that is why we only went up by 1. 2 of these deaths occurred in residents of long-term care facilities, 2 in Hennepin County, 2 in Ramsey County, and 1 in Washington County. And the total includes individuals, 1 individual in their 90s, 1 in their 70s, 2 in their 60s, and 1 in their 50s. We currently have 340 patients that are hospitalized with 160 in intensive care. And just a couple of messages for today. Our testing update, we had 9,556 total lab tests conducted yesterday, which is an increase from the day before, which was 7,264. The daily positivity rate is 3.2%, and the 7-day average testing positivity rate is 3.3%. We're analyzing the testing data from the last 2 weeks of community testing in Minneapolis and St. Paul, and we are seeing significant disparities in the positivity rate. The positivity rate among the white population tested was 0.2%. It was 1.3% among the Black population, 5% among our Asian population, and 7.4% among Latinx. Populations of color represented about 40% of the people getting tested, but 90% of the positive results. These data reinforce the concerns we've expressed before about the uneven nature of COVID impacts as it relates to people of color, not because of any biological issue, but rather due to differences in things like rates of underlying health conditions and job-related exposure risks. We're working to take into account these disparities and concerns in our testing strategies and our overall response. Then I also wanted to mention some concerns that we have related to bar and restaurant activity. We're seeing some increases in disease in South Central Minnesota in young adults in their 20s. And when we have interviewed these individuals, we're getting reports that a number of them had visited multiple bars over the weekend of June 12th and 13th. And these individuals also happen to then work in childcare or healthcare. So we want to make sure that even as we're happily taking advantage of the opening up of bars and restaurants, that people, even if you're young, and even if you feel that your personal risk of COVID is low, that you are continuing to social distance and, wear masks if possible. I realize it's difficult to consume adult beverages wearing a mask, but please then social distance and make sure that you're cognizant of the risk of COVID transmission in a group setting. We really want to emphasize this because obviously the impact maybe less for these age groups, but it has the potential to have secondary transmission to other parts of the community and individuals who may be at greater risk. So with that, I will turn it back over to Mike. We can open it up for questions.
Thanks, Chris. Yes, we'll open it up for questions now, and we'll ask, as always, that you limit yourself to one primary and one follow-up question so we can get to as many as possible. With that, operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the # key. Please stand by while we compile the Q&A roster. We have our first question from the line of Jeremy Olson from Star Tribune. Your line is now open.
Yeah, thanks. Quick fact-checking question for my actual question. Those numbers you gave on testing rates by different racial groups, was that for the community testing from the protest sites only, or is that statewide testing?
That was the community testing from the protest sites, so the testing that was done in Minneapolis and St. Paul.
Okay, and then do you have any explanation for that disparity? I mean, they were all engaged in the same. If they're all engaged in the same protest activities, it would seem unlikely to see that kind of variation. What's going on there?
It may be that individuals were engaged in protest activities, but may have had risk factors for exposure outside of that activity. So in other words, the activity itself the protest activity or the mass gathering activity may have been a lower risk, but these individuals are likely at higher risk because of jobs, exposures within their community, housing, those types of things.
And my follow-up is whether the relatively low positivity rate and some other things, whether this says something about outdoor transmission risk. Have we reached a point where we can conclusively say that you're not as risk outdoors compared to indoors?
Well, yes. I mean, certainly we've said that it's much better to be engaging with people in an outdoor setting. You have the advantage of, airflow, dilution, just better ventilation. All of those things make an outdoor setting, a better place and a less risky place in terms of interaction related to COVID. In indoor settings, the idea, particularly in Minnesota in the summer, oftentimes you use the air recirculation to help keep costs down and to maximize efficiencies related to air conditioning, but that's a problem as it relates to COVID. Actually, you want to have less recirculation of air so that you have more fresh air, and that's what you get when you're outside. So that's why being outdoors is a better spot, safer spot.
Thank you.
Your next question is from the line of Kate Radatz from WCCO Television. Your line is now open.
Thanks, Chris. You brought up this uptick you've seen in South Central Minnesota with people in their 20s. We're seeing, of course, places in other parts of the country seeing a pretty significant surge in younger people that they talk about that have been going out. Is there concern? We've seen a downward trend. Is there concern if that continues, if people are going out, not following the guidelines, that could contribute to then seeing another surge or spike here?
Yes, definitely. We are concerned about that, and that's why we wanted to make people aware of that. And in particular, we want to make sure that our younger adult population recognizes that they themselves may not be at highest risk for COVID, but that if they're engaged in activities where there's social distancing isn't taking place, that means that there will be transmission. So even though they're not high risk for complications, I need to restate that. Our younger populations may not be at higher risk for complications from COVID, but when they're in an environment where social distancing is not happening, they're at just as high a risk of transmission and acquiring COVID, and then they have the potential to spread this to other settings where they interact. And so we want to make sure that, as people are making decisions and as people are out, enjoying a bit of freedom that we have now with some additional opening, that they're cognizant of the fact that they could be a risk factor for someone else. And even though they may not be at risk for complications, they can still get COVID just as easily as anyone else. And as a result, they can spread it to others inadvertently. And I don't think that's something that they want to do.
Got it. Thank you.
Next in line is from Matt Sepik from MN Public Radio News. Your line is now open.
Hi, Chris. Can you talk a little bit more about what's happening in southern Minnesota? Is it just young people going to the bars who are responsible for this uptick in cases in these half dozen counties, or is there something more happening there?
We've got roughly 100 or so cases in that area, and it really is focused on young adults in their 20s who have frequented various bars. And so, that really is at least one of the clusters that we're seeing. So that right now, that's a focus. So it's not broadly within the community. It's been related to those kinds of interactions. But obviously the concern is that these individuals don't necessarily only interact with the same population that they socialize with, and so those other settings may result in additional secondary transmission.
And speaking of bars and restaurants, are they required to report cases of COVID-19 among staff or even among patrons? Are there any rules about that under the deed guidance or the executive orders?
Certainly if they're aware of cases in staff, it's helpful if they let us know. There would be no way that they would be aware of necessarily cases in patrons. But certainly if they're made aware, it would be very helpful for them to report that to us. But we are picking these up through our surveillance system.
Okay, but they're not required to report any cases among staff to MDH?
No.
Thank you.
Next is Chris Nagan from Pioneer Press. Your line is now open.
Thanks. Hi, Chris. I just wanted to see if the folks at MDH had come up with any hypothesis as to why the numbers, especially the deaths, have been so different between Minnesota and Wisconsin. I know you've been asked about this a couple different times, and it seems that case trends are becoming more similar, but we have about twice as many fatalities as they do. Has there been anything that you suspect maybe causing that difference?
Yeah, I have been asked about this quite a lot, and we certainly have had different points in the outbreak, and I'm thinking I haven't talked to you for a while, so hopefully you've had a chance to have a break from this. But at different points in the outbreak, we've been in different places than Wisconsin. So in some early days, we were ahead of the curve, fewer cases. Now, we're in a different place. They look like, they have had, their deaths are fewer, that type of thing. But the comparisons, I don't know if they're completely helpful. We've talked with their health department. We're not doing things particularly different from them. So, don't have a good answer for the differences in death rates at this point.
But you don't suspect that they're following a different criteria to count the death. You're all using the same criteria when you count whether or not a fatality is officially related to COVID-19.
Well, we are in Minnesota. We are counting anyone that was tested positive with the molecular test who subsequently dies is reported as a COVID death. And I can't say. I'm assuming that's what Wisconsin is doing, but I can't say for certain.
Okay. Well, thank you. Just wanted to follow up on that again, so appreciate it.
Yep.
Next is Kerrigan Miller from Minneapolis, St. Paul. Your line is now open.
Hi, thank you for taking my question. I'm calling to follow up on the Amazon center in Shakopee. Do you have updated numbers for the number of COVID infections at that facility?
I can check on that, and let you know here. Let's see. I can't pull it up as quickly as I thought I could. I can check on that. I can let you know that yes, we did get asked. I did get asked about that, and the cases. We were reporting the total number of cases to some media outlets yesterday or the day before, I believe. But just to be clear, the bulk of the cases occurred in May. But I will check, and there have been a couple of cases since then. We worked with the facility. We have a team, a workplace team that reached out to them, has worked with them in terms of steps they could take to improve the safety of the workplace for their employees, and they have taken those steps, and we've seen a reduction in cases. But I will get the most recent numbers, and we can get that to you.
Sure, that's much appreciated. Can you elaborate on what some of those steps are?
It's a matter of, talking with the management and going through, and we did a site visit to say, okay, how are people set up? Do they have 6 feet of distance between them? Are there any choke points? How are you doing breaks? If everyone gets a break at the same time, then there are more opportunities for people to be together in those settings, using the restrooms, those kinds of things. So it's really just sort of talking through the workflow, seeing what the workflow looks like, and making recommendations for how they screen employees, how they ensure that employees can social distance, if there are any physical barriers that they can put up, or what we call engineering controls that they can put in place that would help to minimize the chance of transmission.
All right. Thank you so much for your time.
Sure.
Next is Joe Cox from Minnesota News Network. Your line is now open.
Hi there. As you look at the overall case positive rates from the community testing in the metro after the protests, is nearly a month of time now enough of a window to specifically say one way or another what impact large gatherings with differing levels of social distancing, differing levels of mask wearing, et cetera, might have had on any significant or insignificant spike as was widely feared at the time?
I think that definitely, what we're seeing is that there were definitely differences in terms of the populations that, positivity in terms of the populations that were tested. And, as we talked about, that may be a situation that has to do with other exposures in their world rather than specifically the mass gatherings. And I think that we're pleased to see a low rate of positivity overall, but I also think that the data that we're seeing related to disparities tells us that we still have a number of concerning issues that we need to be following up on, and we need to make sure that we're making testing accessible to our populations of color and indigenous populations, because they really, really need access to testing. So yes, I think that overall, the overall positivity from the mass gatherings is positive, that is low. But on the other hand, the fact that we're seeing these disparities, that is concerning, and that means that we need to continue to ramp up our outreach efforts to these communities.
And my one follow-up, you mentioned those disparities. Can you expand on any of the work that's been done, whether it's via clinical trials, virology, lab studies, whatever it may be, to confirm whether or not that this virus in particular could affect one segment of the population more so than another?
At this point, we feel that a number of the disparities that we're seeing have more to do with systemic racism and some of the challenges that we're seeing, across our communities rather than any kind of biology. But that is definitely something that is continuing to be evaluated because we have seen more cases, more disproportionate hospitalizations and deaths and things in these populations.
Thank you.
Next is Alex Tejeda from KPPC. Your line is now open.
Thank you so much. My question is, I know young people in Minnesota, they suffered the winter, they suffered the quarantine, staying inside. The cases are seeming to go up with them at bars. Do young people need to stay away from bars, go to state parks instead, or go outside when they're at the bars, or just don't drink much alcohol and forget to wear your mask? I mean, I don't know.
Well, right. I certainly don't want to suggest that we don't want people to have fun or be able to, have some level of social interaction. I think the concern is if there's crowding. Certainly, if bars have the opportunity to have people interacting in outdoor spaces, as we said earlier, that's a much better location just because of airflow and the ability to really dilute the virus. So that's an option. And it is true that with the inclusion of alcohol consumption, that can mean that people's inhibitions and perhaps even attentiveness to some of our recommendations about social distancing are likely reduced. And so, people, for many reasons, should be thoughtful about the amount of alcohol they consume. And yes, if it's possible for you to socialize with the crowd that's important to you, and maybe I shouldn't use the term crowd, but the small group that's important to you, and you can do it in a setting in which you're able to fully socially distance and fully maintain attentiveness to social distancing, that is certainly better. But I think that, you can still be at a bar and, have a drink, but you need to make sure that it's not crowded, that you're, attentive to the issues of social distancing. So that's really the challenge. I think once you get into a crowded setting, that's where you have the greater opportunity for transmission.
Awesome. And then my follow-up question is kind of this lackadaisical attitude among young people seems to be shared by our president, who had some interesting comments kind of downplaying it and wanting to reduce testing. Does that have any effect on the motive behind these young people going out, or is it just the feeling of invincibility of youth?
Well, yeah, I can't speak to the individual motives of any given group of people. I think that it's fair to say that all of us have been really excited to have the weather warmer and to have the opportunity to, visit a restaurant or a bar that we haven't been able to. And so for everyone, I think that is a welcome change. And I think it is true that younger populations may not be thinking about health issues as much as, individuals who are older and who may now have an underlying health condition. We know that a large proportion of our population has that. So I think it's probably a combination of things, but I think that all of us are eager to be out and about, and we just have to make sure that we're doing that in a thoughtful and cautious manner.
Excellent. Thank you so much.
Next question is from the line of Jeremy Olson from Star Tribune. Your line is now open.
Hi. Another question. I looked at the dial back dashboard yesterday when the data was updated, and cases with unknown exposure in the community, that rate has gone down in the last couple weeks. And I'm wondering if you can discuss that. I don't know if that's just because there was one outbreak and you knew where all those people were from and that allowed the rate to go down, or if the contact tracing has allowed you to get a little bit more of a handle on where these cases are coming from.
I think that, we do have more data on, where people have been exposed, and obviously just giving the example that I am giving about, bars and restaurants, I think that has helped. And as you said, when we have an outbreak in a particular location, that increases the proportion of people with a known exposure. So I think it's a combination of things that is bringing that down, and also the lower number of cases helps. So our cases are going down in general. We have more cases. More of our testing has been associated with a particular event or situation, and yeah, we're seeing some positive trends.
Related question then, there is a kind of a buzz about people are noticing on their phones if they have Android apps or Apple phones that there's a COVID tracker platform that has been added to their phones, creating the ability for health departments to use that to help in contact tracing. I just wondered if that's something you're looking at or you're going to get into, is the use of mobile phone devices to kind of track people's exposure risks and where they might have come from. Is that off in the future?
That is not something that we're currently looking at, and I guess I'm just looking at I just pulled my phone up and thought, oh my.
Look at your settings.
Yes, I'll have to check that and see. But no, it's not something that we're looking at right this minute.
Okay, just wanted to check. Thank you.
Operator, we have time for one more question.
Yes, sir. Next is Phil Miller from Star Tribune. Your line is now open.
Hi, my question is about Major League Baseball announcing this week that it's going to begin play next month without fans, but with the possibility of allowing limited numbers if local conditions allow. I know it's difficult to predict the course of the pandemic, and that both phase 3 and 4 prohibit gatherings of more than 250 people. But would you envision any possibility that the numbers would ever reach a level in the next 3 to 4 months that a socially distanced crowd at Target Field might be in any way possible?
Well, I can tell you that there are a lot of people that I know that certainly hope that would be the case. They're very eager for the opportunity for the in-person sports watching. I think we'll have to see. Definitely, it's been the information related to the mass gatherings was positive. The fact that what we know when we have crowded situations, as I've mentioned with the bars and restaurants, that can be problematic. So I think it's a situation that we're going to have to keep looking at. And the fact that the games are happening, that certainly makes it a lot easier to move into a situation where a limited number of people could attend, because you have games to attend. So I think we'll have to keep looking at that. So it certainly is possible. I wouldn't say that it's not possible, but I also think
Have a good day, and we'll talk again Friday.
That was today's COVID-19 briefing by state leaders. Do stay with us on WCCO and on CBSN Minnesota for the very latest on the state's response to the pandemic.